Good afternoon, students. Today, I have to again continue this chapter, second chapter. Now, birth control. So, birth controls are the two, that is the contraceptive methods. One is temporary method, and second is permanent method. Now, temporary method already you have to discussed. Now, last bit about the mechanical barrier methods you have to study. Mechanical means the barrier methods. In this method, with the help of barriers, the ovum and sperms are prevented from physical mating. Ovum and sperms so prevent the physically mating. These mechanical barriers are three types. First is the condom. It is a thin rubber sheath that is used to cover the penis of the male during copulation. It prevents the entry of ejaculated semen or sperm into the female reproductive tract. This can prevent conception. It is a simple and effective method and has no side effect. Commonly it is called the Nirodh, is the most widely used contraceptive by males. It is easily available and is given free by the government also. It should properly discarded after every use. Condoms is also a safer against the STD, sexual transmitted diseases, as well as the AIDS. It is help for the using the condom. Second, diaphragm, cervical cap, and vaults. These devices used by the female are made up of rubber. They prevent conception by blocking the entry of sperms through the cervix. The device is inserted into the female reproductive tract to cover the cervix during copulation. So internal, that is the again in female, that is the cervix close, that is the coverings are present. It is called as the diaphragm, cervical cap, and vaults. Now third one, intrauterine devices, IUDs. These clinical devices are plastic or the metal objects. A doctor or trained nurses places the IUDs into the uterus. These devices include the lips loop, copper releasing, like this, used for this intrauterine devices. Next one, permanent method. So already we have to studied about the temporary method, birth control, that is the temporary method. Now second is the permanent method. Permanent methods are the surgical methods or it is the sterilization. First is the vasectomy in male. In vasectomy in male, the mainly vasa differentia tied and cut. Vasa differentiate is cut and tied by that is the thread. The sperms cannot be comes in that tube. So it is the cutting of the vasa differentia. It is in male, so it is called as the vasectomy in male. Second, tubectomy in female. Here also fallopian tubes tied and cut, that is the fallopian tube, it is cut and the tied cannot be entered, it is the sperm and fertilization can be prevented. So it is the second, it is called as the tubectomy in female. These are the surgical methods. Now next, medical termination of pregnancy, that is called as a MTP. MTP, medical termination of pregnancy. In this method, intentional termination of pregnancy before full terms includes, that is the absorption safe till 1 trimester of pregnancy. Role in controlling population unwanted pregnancies, defective development of fetus. Defective development can be examined by amniocentesis. This method can be mainly, government can be medical termination of pregnancy. Now next, amniocentesis. It is the process in which amniotic fluid containing fetal cells is collected using a hollow needle inserted into the uterus under ultrasound guidance. The chromosomes are studied to see the abnormalities in the developing fetus, but the dangerous trait is misuse of amniocentesis to determine the sex of unborn child. That is the identification of sex also by the help of this method. Frequently, if the fetus is found to be female, it is aborted, which is totally illegal. That means abortion also, by the help of this method, the development of the internal child, they can be identified. So Government of India has legalized MTP Act on 1971, which started condition to avoid its misuse also. So it is the mainly seconded the type. Next, this is totally the illegal. So the Government of India has legalized MTP Act on 1971, stricted the conditions. Medical termination of pregnancy, amended Act on 2017, to reduce the incidence of illegal abortion and consequent material mortality. MTP requires consent of female undergoing this procedure. According to MTP Act, pregnancy may be terminated one within first 12 weeks to more than 12 weeks but lesser than 20 weeks. The registered medical practitioner's opinion is mandatory starting the continuation of the pregnancy would involve a risk to the life of the pregnant woman or to the next one. Sexual transmitted disease, STD, venereal disease, or the reproductive tract infection, RTI, reproductive tract infections. Some are the diseases. The name of the disease: syphilis, and second the gonorrhea. Causative agent: uh, Treponema pallidum. It is the bacteria, and gonorrhea, that is the Neisseria gonorrhea. This is also bacteria. Incubation period 3 to 4 weeks. In male, it is the 2 to 14 days. In female, it is the 7 to 21 days. Infection site: mucous membrane is genital, rectal, and oral, that is the region. Mucous membrane of urinogenital tract, rectum, throat, and eyes. Symptoms: primary lesion called cancer at the site of the infection is formed on external genital skin, rashes and mild fever, inflamed joints, loss of hair, paralysis, degenerative changes occurs in the heart and brain. So in gonorrhea, in males, blocked the partially blocks of the urethra and reproductive ducts, pus from penis, pain and burning sensation during urination, arthritis, etc. In female, pelvic inflammation of urinary tract, sterility, arthritis, and children born to affected mothers suffer from gonocola, ophthalmia, and gonocola vulvaginitis of girls before puberty. Preventive measures: it is mainly education about sex practices, sex hygiene, avoiding sex with the unknown partner or multi-partners, using condom during coitus. Sex, that is hygiene, using condoms during coitus, avoiding sex with unknown partner or the multi-partners. So treatment, that is the antibiotic penicillins are given, or it is the antibiotic cefixime. These are the treatment for these sexual transmission disease. Now next, infertility. Infertility is defined as the inability to conceive naturally after 1 year of irregular, unprotected intercourse. The causes of infertility could be physical, congenital disease, immunological, or even physiological. The common physical causes in females are polycystic ovary syndrome, PCOS, or the hormonal imbalance, endometriosis, while in male it is less sperm count and small size penis. These also affect for the infertility. That means fertilization, that is the no fertilization. Now period of 1978, infertile couple had two options: adopt or be childless. Today, infertility couples have many options to have a child, such as fertility drugs, test tube babies, artificial insemination, IUI, surrogates, motherhood, etc. The couple could be assisted to have child or children through certain special techniques commonly known as ART, assisted reproductive technologies. These nowadays it is adopted. Okay, so next we have to study about the next lecture remaining.